So I just finished treating the lower windswept pelvis. And can you tell us how you feel?
I feel fantastic. I feel normal. I feel aligned. Incredible.
So you took a walk.
Yes.
And you felt like the pelvis was moving symmetrically.
Yes. Completely
Okay.
symmetrically.
Very good. I'm going to show that the compensation, I think, has resolved. And I can glide it now to the right further to an end point. And then if I add additional stress, it glides over to the right. So the compensation is improved. What's interesting is that she does feel like her pelvis is balanced now. Feels like it's aligned. Feels like it's moving symmetrically. But what's interesting is her pelvis has a developmental asymmetry. So that's how her bones developed. So there's a degree of alignment that I'm not going to achieve because the movement is normal in all directions. So that translates to what we do when she sits. This ilium is a little bit forward, it's a little bit lower, and that's how the bones develop. So when you go on YouTube and you see all this talk about alignment of the pelvis, that's not going to happen here. Okay? This is your normal alignment. Okay? And let's have you lie on your stomach. And looking at the alignment of the lower pelvis, it's better, but it's not quite the same. You have, like, on the right side, you have a thumb width and a half of space now, maybe 2 thumb widths, and you have 2.5 or 3 on the left. But more importantly, we have restored spring mobility. And tomorrow I'll teach you exercises that will keep that mobility, so you won't have to keep coming back and seeing me or seeing anybody else. Mm-hmm. Okay? Furthermore, most therapists don't know about this lower windswept pelvis. It's a pattern I discovered, and I developed the treatment for it. So unless they've studied my work, it's not in the literature. Okay? Now, this asymmetry does not bother her in standing. It doesn't bother her when she lies on her back. But let's look at what happens when she sits. So let's have you come sit in the chair, please. So when she sits, can you describe how you feel?
I feel as though the left side is going just a little bit further back, and maybe the right side is just a bit interior.
Okay. Is there any discomfort in sitting?
No. Mm-mm.
Okay. What I know is the left femur is longer. Okay. The height seems equal. You're putting your foot down on both sides. Put your feet flat. The height seems, if there's a difference, it's pretty subtle. Okay. Mm-hmm. Now, what happens when I take this soft foam dowel and I put it under your right trochanter?
Then, well, the first thing I notice is obviously it's even at the end, and I feel like I'm sitting more normal, for sure.
Yes, yeah. So what happens is you have a pelvis that's developed asymmetrically. Then you sit in a chair, and it's symmetrical, and it forces you into an abnormal posture. Mm-hmm. So what we're doing is we're recreating your asymmetry with that foam under the right trochanter.
Mm-hmm. Yeah, that makes sense.
Good. So whenever you sit more than 15 minutes, it's good to put that under that trochanter. Mm-hmm. You'll have to make sure you remember when you go sit in a restaurant, make sure you don't forget it. I've done that. Mm-hmm. So one key thing I want to reiterate is that her pattern was different today than yesterday. And so when treating the pelvis, treating biomechanics of the pelvis, when treating the sacroiliac, it's important to reevaluate it the next day because it might be very different and you have to treat that which is different.
Sure.
And that's the way the pelvis functions. It's not unusual for the person to come back with the movement pattern having changed. And then you just treat the new pattern, and within 1 or 2 visits you get to the core pattern. And so that was informative, and then it was interesting to show the compensation in the upper cervical that we didn't have to treat. Mm-hmm. So the pelvis can affect the upper cervical spine, And I could have worked on the upper cervical, but never have been able to restore that movement because it was driven by the nervous system. So instead, I had to go down to the cause.
I see.
Okay? And again, tomorrow I'll teach you how to keep this movement so you won't have to keep seeing me or anybody else for this problem.
Yay! Look forward to that.
Thanks very much for letting me film this.